So our program continues with the plenary lecture, COVID-19 and Wellbeing, Building Back Better Lives, held by Romina Boarini. Dr. Boarini is the director of the newly established OECD WISE Center, WISE standing for Wellbeing, Inclusion, Sustainability and Equal Opportunity. Romina is joining us here in Helsinki via video connections. I hope they are. Yes, she's there. Welcome, Romina Boarini, and the stage is yours.
Thank you so much. Good morning, everybody. It's a pleasure to be with you today. Can you hear me okay?
We hear you very well and see you also.
Okay, very good. All right. So if you can kindly put on the screen my next slide, please. Excellent. And the second one, you can go on, please. So thank you so much. Before I actually go to the core of the lecture, let me just in a minute, actually even less than a minute, tell you about the WISE Center. Indeed, we are a new center created last year, and the focus of our mission is improving people's well-being. This is, of course, a mandate that my organization, the OECD, has worked on for years. And last year, it was decided to actually take this important agenda to the next level and really ensure that we would work on this agenda, not only to develop metrics of well-being, which is something that we have done for many years, but actually also to increasingly put the notion of well-being at the center of policy making. So at the moment, and all our activities are about developing policy insights, understanding how policies should be designed to improve people's well-being. Next slide, please. So let me start by telling you about the OECD Wellbeing Framework, which is in a way the central tool that we constructed in the OECD to look at the living conditions of people and how they feel about those living conditions. So that's really the way we conceptualize and measure well-being. We're looking at it from the perspective of understanding the dimensions that matters to people's lives today. And this is what you can see in the upper part of this diagram. There are 11 dimensions of economic and non-economic well-being. And of course, you will see immediately that health, and by that, of course, we mean both physical and mental health, these are core elements of those lives of dimensions that matter to people. But we're looking at those not just in aggregate terms, but actually we are also looking at the distribution of outcomes. And so we pay a lot of attention to the notion of inequalities of outcomes, but also inequalities of opportunities. We not only look at current well-being outcomes, we also look at what are the resources, what are the key assets that governments need to invest and build on over time to ensure that the levels of well-being can be sustained. And from that perspective, we're looking at four important type of capitals: natural capital, economic capital, human capital, and within that actually we include not only education but also health, once again, and finally social capital. And we are measuring them by looking at stocks, flows, risk factors, and resilience. So again, this is really sort of the central framework that we have in the center. And this is what we usually unpack to, in fact, carry out all our analysis. So next slide, please. What I'm going to concentrate on today is actually a report that is not out yet. So, you're going to have a preview of this report. The report is, in fact, until embargo, is going to be launched next week. And this report talks about COVID-19 and well-being, life in the pandemic. So really, it documents the various effects that the pandemic created in terms of people's well-being. We are going to, during this, in fact, during the launch of this report next week, you have all the details here. So please join us and register if you are interested to know more. But we are also, of course, going to celebrate the first year of existence of the center. So in the report, we look at really the well-being evidence that we have collected over the last couple of years. And for the first time, we're also looking at, in fact, what should be the policy actions, what should be or how, in fact, the well-being framework and the well-being evidence that we have collected in this report should inform the recovery plans and the Building Back Better. And today, so I'm going to offer you a few results on, of course, aspects that relate mostly to mental health, and in particular also what it means for, for concrete policies that should be taken in the light and in the wake of the pandemic. Next slide, please. Mental health was already a concern pre-COVID in many OECD countries. In 2016, more than one person in 6 across European OECD countries had a mental health problem. In 2017, that's from suicide, acute alcohol abuse and drug overdose were actually 3 times higher than that's generated from road accidents. And also mental health issues were rising among women in more than 1/3 of OECD countries. The situation has deteriorated since the onset of the pandemic. And of course, we can explain why. This is because the pandemic has combined a number of threats to mental health. Of course, that's of relatives and friends, but also fear of contracting the virus, fear of spreading the virus to loved ones, disruptions to daily routines, school closures, losing employments, and having or experiencing economic insecurity. And all those threats actually being experienced in a moment where we were all physically distant from friends and family. In other words, we were all very physically distant from the factors of resilience, the productive factors that very often are there indeed to mitigate sort of the bad inputs. In fact, over 1/4 of respondents in 15 OECD countries were at risk of anxiety and depression in 2020. And both rates of anxiety and depressions actually increased slightly, but significantly in the first half of 2021. Next slide, please. In fact, it can be difficult to compare pre-COVID data with the data collected during the pandemic because different mental health instruments are used across surveys. So you don't have a stability of the surveys and the other sort of type of instruments, unfortunately. But in 8 countries, we were sort of lucky enough actually to have that comparison being established. And so where we have comparable baseline measures, among them, in fact, we do have some Nordic countries, we see that the share of respondents at risk of depression by mid-2021 rose significantly since 2014. In some countries, actually, that increase is larger than 20 percentage points, which is obviously huge. Next slide, please. As I mentioned, for us, it is very important in the work we're doing on well-being to not just look at the average well-being conditions, but actually to look at the conditions of well-being across different groups in the population. And we see that inequalities are pervasive, in fact, in many dimensions of life, but certainly mental health is a good illustration of that. So we know that gender gaps, in fact, widened during the pandemic. And in fact, women have been one of the groups that has been sort of hit the most by the increase of mental health issues and mental distress. In 2020, women had higher rates of depression than men, as in fact it was already the case before the COVID. But we, as I just said, also have evidence that the gaps have widened since the start of the pandemic. Next slide, please. Another group that has been strongly hit negatively in terms of mental health by the pandemic is youth. And so this is actually a difference with respect to gender, because as I just said, the gender gap, we're already there before the pandemic, but actually young people before the pandemic were less likely to report symptoms of anxiety or depression than the general population. And in fact, COVID-19 has sort of reversed this situation. And we see that actually the very young are the ones that during the pandemic have been affected the most in terms of mental health. In addition to elevated depression that you can see in the slides and anxiety, we also have witnessed eating disorders that have been on the rise for young people during the pandemic. Symptoms of depression and anxiety are also more common, or were more common among the unemployed and those experiencing financial difficulties, as you can see in the second panel of this slide. Next slide, please. Now, we made an effort to try to look at the mental health conditions of migrants and people coming from some underrepresented communities and minorities, such as racial and ethnic minorities. Unfortunately, the data situation is not great. We don't have a lot of comparable evidence across OECD countries. But wherever we do have data, what we see is that migrants' mental health seems to have declined more than for non-migrants during the pandemic. For instance, in Germany, the people with a migration background did experience a sharper increase in symptoms of anxiety in April 2020 as compared to pre-pandemic years. And again, this is a difference, meaning that we are actually looking at this at the difference in that increase as it experienced among the ones that have a migration background with respect to those that do not have a migration background. So we really sort of control it for sort of other factors. And so we do believe that the fact that they were coming with a migration background had some influence on the increase of mental health experience during the pandemic. Gaps in mental health outcomes between racial and ethnic minorities were large and in some cases increased over time. For instance, in Canada, where we do have evidence, we see that similar proportions of visible minority and white participants reported that their mental health had worsened since the beginning of physical distancing between May and April 2020. However, a larger share of visible minority participants rated their mental health as fair or poor and exhibited symptoms of generalized anxiety disorder in the previous 2 weeks. We do see similar patterns in other countries with available data by race and ethnicity, such as in the UK and the US. Next slide, please. And as I already mentioned, now we have a good understanding of what may have been the drivers of that deterioration of mental health that we have seen in many countries during the pandemic. And in fact, we know that other well-being factors can partly explain the impacts on mental health. In fact, in our report, we actually show that it's very important to take an holistic view on people's life because that gives us precisely the clues that tell us how the well-being risk and resilience factors have affected the mental health of some groups in particular. For instance, when it comes to youth mental health, we know that young people have especially suffered against a backdrop of school closure, but also labor market shocks. In many countries, of course, the youth were the ones sort of on the frontline jobs, meaning that they were, in fact, the first people to lose their jobs, very often, working temporary works, temporary jobs, but working in the industries that have been affected the most by the by the lockdowns. And this is actually something you can see in this slide that shows that the young workers in many OECD countries and the vast majority of OECD countries actually experience higher rates in unemployment than older peers. But of course, the reason behind an increase of mental distress among the youth are also the disruptions to mental health services in schools and workplaces. while many people have felt lonely during the pandemic, unemployed and young people and those that were living alone were actually the ones that obviously suffered the most from loneliness. And in fact, the youth, the unemployed, and the ones living alone were more than twice as likely to feel lonely as compared to the general population. The report also shows that women have picked up the major share of unpaid work, in particular childcare, during the pandemic. That life satisfaction for parents of school-aged children fell, particularly in areas that underwent more school closures. And we know that, in fact, the response of OECD countries, in that area were quite different. Some countries really sort of practiced a kind of a very, very, I would say, significant closing of schools and quite continuous across time. And other countries had a very different policy on opening or leaving sort of school open and operating at the same time, homeschooling. And finally, in countries with data, racial and ethnic minorities, we also know that, in fact, it was precisely those racial and ethnic minorities that were actually dying in larger numbers. And of course, those minorities have also been affected more by unemployment and financial struggle. So this is just to give you a sense, of course, that, we shouldn't look at mental health sort of in isolation, but we need to look at, from the perspective of the many different changes in lives that the pandemic has caused, not just as a sanitary and health sort of crisis, but also as an economic and a social crisis. Next slide, please. So, as I mentioned, for us, the evidence is there to essentially tell us in which way policies can be informed by what we have learned in terms of the inputs of the COVID on well-being. And so what we are suggesting in this report is to, in fact, put a well-being lens on the recovery. And we believe that adopting that perspective is something that is necessary to reprioritize policy actions, but also to redesign some of them, to realign those actions across policy departments and reconnect people and the public institutions that are there to support people. And so I'll give you a few examples of what we mean by this for the 4 R's that we have included in the report. When we talk about reprioritize, for instance, we are calling on policymakers to focus on creating sustainable, inclusive and high quality jobs, as opposed just to, increase sort of the number of jobs. Is not a quantity target that we need, is a quality target that we need there. And we know, of course, that the quality of jobs makes a huge difference to the mental health of people. In terms of redesigning, for instance, and when it comes, of course, to mental health, we are suggesting to strengthen mental and physical health promotion and prevention by acknowledging the wide range of economic, social, relational and environmental factors that influence health. And I'm going to say a little bit more in the second part of the presentation. By realigning, what we mean is that we should really, the government should really try to design a whole of the government approach to raise the well-being of disadvantaged children and youth in particular. And again, it is really about connecting the actions that government is taking across the board. So we need to move sort of beyond silo implementation, but really sort of get a sense of the synergies that exist across the different actions, and also, the consequences sometimes are unintended, but the idea is really to factor in all the possible externalities of policies and make sure that the package there is one that improves people's well-being overall. And finally, by reconnected, what we mean is that there are channels and possibilities to reinforce trust by strengthening, for instance, public sector's competencies and values, and also by encouraging meaningful citizen participation. In fact, during the pandemic, there have been cases where indeed there have been a number of interesting initiatives that were co-constructed with the citizens, including to manage some of the very, very critical impacts of the pandemic. And we have evidence that those examples where citizens were directly involved in designing some of those responses, we actually saw that the well-being of people has decreased the least. Can we go to the next slide, please? Let me now focus in particular on our policy recommendations on mental health. First of all, we need to certainly invest in better mental health care. The access to mental health services was already limited before the pandemic. 67% of working age adults with mental distress who wanted mental health care actually reported having difficulties accessing to it. So this is 2 people in 3. So they had difficulties in getting actually access to good mental health services. And in 2020, hospitals, and in particular the hard-hit regions, actually used the beds that normally are reserved for mental health patients to care for the patients that were infected by COVID-19. And of course, there was also an issue with people that were avoiding in-person care just because of fears of contracting the virus. And so, in fact, as a consequence of that, many mental health services were completely or partially disrupted following the pandemic outbreak, with 57% of OECD countries reporting disruptions to services for older adults, another 57% reporting disruptions in things such as psychotherapy, counseling, and psychosocial interventions. We had distractions to the in a proportion of 48% in work-related mental health programs, 52% in school mental health programs. And the disruptions to school-based services in particular certainly have contributed to the decline in the mental health of young people. Now, in response to that, the positive fact is a number of OECD countries have introduced new modes of mental health service delivery, including telemedicine, online therapy, and distress online. And while research has shown that telemedicine can be an effective way of improving mental health and barriers to access, it can be effective, but still there are still barriers to access, such as lacks of reimbursement or lacks of digital literacy. And so in a way, those remain sort of, the stumbling blocks, especially for the elderly and for the individuals coming from a disadvantaged and low income background. So certainly, I think the innovation that we saw, were very much sort of encouraging during the pandemic, but we also know that they were not sufficient in a way to provide the mental health help and services that was required during the pandemic, in particular by the neediest people. Next slide, please. Now, I focus very much on the health care system, but we also know that it will be equally important to go well beyond this healthcare system, because the pandemic has shown that it is so important actually to engineer in the system mental health promotion. And we know that the successful strategies to promote good population mental health need to take an holistic and people-centered view that actually recognize that the ability to thrive for everybody depends on the broader living conditions and quality of life as experienced by individuals, families, and communities. And this is why in our WISE Center, we're launching a new project that is going to run for next year and a half that applies a well-being lens to population mental health and really attempts at building synergies with the whole of government approaches to well-being that are now under development in a number of countries. So in this project, again, really the focus is to first of all, focus on population mental health as opposed only to the ones that are experiencing mental health distress. We're taking an integrated approach. As I mentioned, we're using the entire well-being framework to understand the determinants of mental health and what are the possibilities to prevent mental health issues and promote positive mental health. And we are looking at really sort of not just the mental health, but also the positive mental health. And the whole idea is not only to generate new evidence on this, but also obviously also to create a space for peer learning where countries can come together and share what is working in terms of their policy practices and their programs and how they can learn from each other in doing that. Next slide, please. So very quickly, some preliminary results from the project actually illustrate why it is so important to take this integrated approach. The figure that you have in the slide shows the ratio between people with mental distress compared to people without mental distress, and you can see that along a range of well-being deprivation. So you have all the sort of well-being dimension that I showed to you that we include in the well-being framework, so the one that I showed to you in my second slide. And so for each of those, actually, we are looking at the outcomes for those that have mental distress as opposed to those that don't have mental distress. And we can see that the ones with mental distress show significantly and systematically worse outcomes across all areas of well-being, be it about material conditions, quality of life, or relationships. And in fact, the largest gaps are in life satisfaction, health, material deprivation, job satisfaction, satisfaction with time use, and satisfaction with personal relationships. And interestingly, these findings mirror the general literature on the social determinants of mental health. And in fact, the report on COVID-19 and well-being that I was just presenting earlier gives social prescribing as one of the examples of a more preventative and holistic approach to healthcare that considers social determinants. We have some good practice coming from the UK. We know that in the UK, social prescribing enables general practitioners, nurses, hospital discharge teams, police, and other primary care professionals to actually refer patients and clients to trained link workers. And link workers are the ones that support people in developing and achieving a personalized set of health and social goals by engaging with local non-clinical services and initiatives. And those initiatives are very many. They can be debt management workshops, they can be career coaching, they can be sport classes, working groups. There are very many. And these are really the types of policy examples that we will explore in the Mental Health and Wellbeing Project. And coming to the end of my presentation with the next slide, please. And this is just to invite you all to the kickoff conference on wellbeing mental health. As I mentioned, this is sort of the official meeting through which we start the project on mental health and well-being. You have all the information here. This is going to be essentially 4 days, short days actually, because it's only each day 2 or 3 hour sessions that we are putting together. But we are bringing together and committing a number of world leading experts and scholars on mental health. So the objective is really sort of again to take a look at the multidimensional drivers and social determinants of mental health. But also obviously discuss the many statistical challenges that still remain to actually come with a good tracking and modular system on mental health, especially when we're talking about population mental health, and especially when we're taking not only the sort of Hill mental health approach, but also the positive mental health approach, as I was just saying. And finally, of course, the conference is going to discuss about the lessons that we're learning from the integrated policy approaches that have been put in practice, into practice so far. So number of speakers are expected. Please join us for this very important event. And you have in the slide and in the next one as well, the contact of the WISE experts that are in charge of this project. So very happy to, well, first of all, take your question today, but also continue actually to correspond in the future and collaborate with all of you on these very important issues. Thank you.
Thank you very much, Dr. Boarini, for this invitation and also this chance to get a glimpse to the report that is not yet published. So I think we now have time for maybe 1 or 2 questions or comments. So are there any online? No comments online. How about here in Helsinki? Yes, please do. The microphone is coming.
So, Dr. Boarini, fantastic. I'm Fredrik Lindgren from Sweden. I've been happily engaged in some of the work you've done in OECD, also with the mental health unit before. And yes, a big applause for this initiative. My question is, if you start to see psychological resources as a means to other ends, which is also one part of, I'd say, well-being, it would be really interesting to look at if we're investing more in psychological resources in the population for everybody, how is that helping us to achieve other kinds of societal outcomes? So the reversing this interdependent relationship. Would you, in the program around mental health, also look at that, how improved psychological capabilities will lead to other societal outcomes?
I don't see any more hands up,
thanks
so
so
would you
much,
like to
for the-
answer? Sorry.
Okay.
sorry.
Or yes. So maybe you want to do you want to take other do you want to collect other questions first, or?
I was just maybe saying that I don't see any more hands up, so now it's the final possibility. No, so please answer.
Yes. Certainly we're going to look into psychological resources. This is certainly what we would qualify as sort of factors of resilience. We've done a bit of that work for in fact, for child well-being, because we know that those psychological resources are quite key. So there is quite, I would say, a focus or an emphasis from our side being placed on the notion that those psychological resources are things that certainly you want to start building early on, and this is why sort of I would say we insisted so much when we're talking about cognitive developments of the very young kids to stress the building up of those psychological resources, what it takes, and obviously where this is coming from the family, but not only. I believe that in this project we will also look at this across the life cycle, and so how you do that, you build up psychological resources also for adults. I believe that there are still data challenges as we want to do that, especially if we want to take the international comparative perspective. So I don't think that we have necessarily a very complete data set that will allow us to look into this, but certainly we are going to select or to identify sort of key studies from which we can learn. So it's a great question, and I would certainly follow up, and my colleagues will follow up and we'll let you know, if we are going to do anything specific on that it is a very pertinent point. Thank you.
So thank you once more.